So a really good question is the lower face. When we split the face into an upper third, a mid third, and the lower third, how to deal with these marionette lines here and how to inject them effectively. So this is information only, and it's informative to obviously injectors who are maybe less experienced or who basically, I've 10,000 hours of injecting Botox and fillers. And I think a lot of what you learn, I've degrees and diplomas and masters and all the rest of it, but a lot of what you learn is on the job. So if you're going to tackle the marionette lines here, then the best thing to do is fan the area with, and again, no heavy fillers, just again, the level, the name and the number. So if you've Juvederm 2, the molecules of hyaluronic are smaller than they are in Juvederm 3, than they are in Juvederm 4. Also, Juvederm 3 is basically Juvederm Smile. The ultra part of the name means there's lidocaine in it. So when I first started off, I'm a DDS as well. So we used to inject in here to numb the lips before we injected the lips. Then the Allergan introduced lidocaine into the filler, into the product. And that became difficult because when you're using lidocaine, it vasodilates the area and it kind of pumps it up. And so you've no idea of what the baseline is. So it's probably easier now that it's just the little bit of lidocaine in the Juvederm, because actually, to bear in mind, it doesn't actually work until the product is in. So it's kind of a double whammy insofar as until you inject, the product isn't going to numb the area. So you're still going to feel all the injections. The only thing it's beneficial for is, for example, if you're going to do Botox along the upper lip, or you're going to inject into the upper lip upwards for smoker's lines. Obviously, if you put it in the lip and then leave it 4 minutes, that area will be numb. So the other two operatives of the little mini Juvederm and the Botox here, you won't feel. But for the most part, it's going to be something that you do feel. And it's probably better for the injector that there is no vasodilation of the area. So again, back to the marionettes, and we're dealing with the lower part of the face. So again, the idea would be to fan something mid-sized in here. Juvederm 3, certainly not Juvederm 4, it's too heavy. And then the same on the other side. And then also if you come around this side and inject up, this side and inject up, it'll turn the mouth up, but it won't give it that, no one wants that frowny, clowny, weird face. And again, have this information, watch this video a couple of times, write down a few notes, go and ask these questions to your injector. If you have a nurse injector, if you're going to a doctor, whoever, ask these questions because they'll certainly know that you know your stuff. And from an educational point of view, remember, Botox, the upper third of the face. The mid face is a mix of Botox along here and then filler here and filler here. And then you can have some Botox along the upper lip is quite good. And then obviously the lower third of the face is mostly filler here, mostly filler here. You can have Botox along your jawline. I do some stand-up comedy and I always say you got to be super careful. Too much Botox in the neck and in the platysma bands, you're going to relax the breathing apparatus. You're going to need to be intubated. Don't worry, it only lasts 3 to 4 months. Same as the face, it will wear off. You'll be back breathing independently in no time. But jokes aside, you have to be careful with the neck and especially with the platysma band.